Okay, we'll go ahead and call the meeting to order, and we're going to start with consideration of approval of minutes from our October and November meetings. If I could get approval.
I'll second that.
A first and a second, all in favor?
Aye.
Opposed? Same sign, motion carries. Met staff meeting summary, Dr. Anderson is
I don't think he's
not
going to be here
here
today, so I think you're stuck with me.
okay. That's good.
All right, well, we have 2 months to go over, November and December. So Med Staff met on November 12th. Dave Bauman from Senior Life Solutions joined the group. He introduced our new medical director, Dr. Amanda Bennett, over Zoom, and the doctors were able to put a face with a name. Just talked about the services we provide over at Senior Life Solutions, having individual group therapy for adults 55 years and older. Jill Megas introduced our new dietitian, Catherine Garcia Rosas, who has joined us and does an excellent job. Christy reviewed the financials from September. She stated that Brenda Fries in Fiscal Services will be retiring in late December. Ashley Snyder will be taking Brenda's position. And Nancy Grau joined the group and talked about a new contract we have for remote pharmacy. Basically, it's overnight pharmacist available for staff for any questions or to verify medications. So added safety feature there. And Mary talked about the Epic upgrade that happened the previous Friday. It went very well. Then on December 10th, the medical staff met. Jill Paulson, one of our CRNAs, joined the medical staff. Discussed, but in the last couple of months, we've had about a 10% cancellation rate for surgeries due to patients failing urine drug screens prior to surgery. So basically talking to the medical staff, just asking them to reinforce that patients are not to use any extracurricular medications prior to surgery. So we talked about the Department of Inspections and Appeals and Licensing. Had our survey. It's been almost 5 years since our last survey. We had 2 pretty minor deficiencies that we have sent the plan of correction, and then since this meeting that was accepted. So yeah, that's all done. Let's see, then on November 6th we had joint conference committee, which we'll go over in a little bit here, and infection prevention. With the DIA survey, the fire marshal was here, so Jeff reported on a few of the policies that we need to update after the fire marshal was here. Michelle Munson joined the medical staff. She talked with the medical staff about utilizing nitrous oxide for our labor or OB patients. This is something that was in vogue a long time ago and now is coming back. It is a self-administered medication. It's very fast acting, basically in the system and out within about 2 minutes. So it's another way for patients to have some pain control during labor. Kim gave the immunization report to the medical staff. Jill gave updates on recruitment. Nicole joined the group with Dr. Daniel Danishvar. He is our interim surgeon until until February of 25. Let's see, I think you guys were going to already talk about the physician advisors and med exec group. Christy also went over financials for that month, as well as talking about some payers that are denying some claims for respiratory panels. So we discussed some options that we can utilize while still getting the testing done, but just doing it in a different fashion. And then she also talked about affirm testing, which again is just another test that if we do it a little different way, we can get paid from payers. So just going over that with the medical staff. And Health Partners of Southwest Iowa, our credentialing service is now installing a new software package that they're learning. Any questions on anything? 2 meetings wrapped up in one.
All right, no questions for Karen. We will go ahead and move on to the quality improvement report.
Okay. Our last system-wide QI meeting was on November 20th, and at that meeting we had 13 departments report. Some highlights from that meeting are that the diabetic education reported that they monitored hemoglobin A1C levels and a reduction pre and post education. They saw, again, a 2% reduction in that A1C level from 9.1% to 7%. This is really a consistent trend following education from our diabetic educator, which is great. Diagnostic imaging monitored imaging rescan rates, which was 3.5%, and our goal is to be under 6%. The emergency department reported 100% compliance with transfer communication. Med-Surg is monitoring post-hospital appointments and making sure that patients have their appointments scheduled prior to discharge, and they also implemented a new monitor related to surgery, a surgery checklist. OB reported the primary C-section rate to be at 0%, which is great. Pharmacy reported no adverse drug events, and respiratory therapy put in place a new monitor for ventilation or ventilator documentation and ensuring that that is appropriate, which was at 100% as well. So it was really overall a great QI meeting and reporting from departments.
Any questions for Laura? Okay, great. Now we'll look at the consideration of approval of the Joint Conference Committee dated November 6th, 24 policy and provision revisions, and Karen's going to take care of that.
All right, so just a reminder, we do this Joint Conference Committee 4 times a year. A lot of it supplies a lot of that DIA when they come in and survey us. So we go over our policies and procedures. We break all of the hospital departments into the 4 times a year, so we go over their full policy and procedure manuals at least once a year. And then at each meeting, we do anything new from the previous meeting. So I won't go into detail on the full policy and procedure manuals, but all of their information, they bring that to the meeting. These are the changes since the last meeting. I'll pass those around. So the full department policy and procedure manuals from November of 23 through October of 24. We did credentialing, discharge planning, education, fiscal services, infection prevention, maintenance, marketing, OB birthing center, pharmacy, we got lots of couple pages there, quality improvements, rehab services, and respiratory therapy, rural health clinic, and the safety manual for the facility. So then we do the changes since the last meeting, so these would be the quarterly procedures from July through September. Some of the ones we reviewed were diagnostic imaging. They did formulate a couple of new policies. One is Lasix. When they do nuke med for renal functioning, they'll use the medication Lasix for that. And glucagon for the medical staff approved the glucagon for it's a MR enterography testing. So otherwise, just a few minor revisions to some other policies for diagnostic imaging. Human resources, for travel expenses, they increased the dinner meal reimbursement. Absence and tardiness, just talked about progressive discipline for the standard disciplinary action form. Security system name badge and access cards that basically, any non-employee cannot be using cards. Those are only for employees. HIPAA privacy violations, and just basically making sure that only people who need to look at a record or protected health information are the right people who are doing that. And then job openings, references to Myrtue Memorial Hospital were changed to Myrtue Medical Center. Outpatient department, we had a couple changes to some allergy shot guidelines. So basically any of our patients who are seen maybe in other facilities and their doctors order allergy shots for them, they can come to Myrtue Medical Center and have those allergy shots done. So, but we have to approve those guidelines for each separate clinic or practitioner. And then most of the rest of the revisions were reflecting current practice. That was pretty much it. Unless there's any questions anyone has. Like I said, the actual policies are in that book that are going around. So.
No questions. Can I get approval of Joint Conference Committee policy and procedure revisions?
I make a motion as presented.
I'll second.
A first and a second, all in favor?
Aye.
Opposed? Same sign, motion carries. Next, about the Personnel Committee report, credentialing by Janine.
The Personnel Committee met previously. Under credentialing, we had 7 initial appointments, 27 reappointments, 26, I'm sorry. 1 additional privilege, and there was a lot of them, 12 voluntary withdrawals. I make a motion to approve these.
I'll second the approval. First and a second, all in favor?
Aye.
Opposed? Same sign, motion carries. Next, we'll go to the CEO report for the consideration of approval of the insurance renewals for 2025 by Barry.
So you should have that in front of you. This is something I went over with the Finance Committee last week in quite a bit more detail, but so it lists out all the types of insurance that we have and what our cost was this current year compared to our renewal for next year. We are going to see about an 11% increase overall, with the cost going up to $822,929 from $740,000 last year. Some of the main increases are property and the wind hail buy down went up pretty significantly, and then we also seen some increase in the healthcare liability package. We did see our workers' comp drop off a little bit this year, so had good experience in that area. Just to give you some background, we do use FNIC as our broker. They work with our local broker, the agency, on the majority of this. The only place where we go outside of that is with our workers' comp, and we've used Assured Partners in Des Moines as our broker for workers' comp. Any questions about that? I do need to get approval from the board. Like I said, the Finance Committee has spent a little time looking at this, and but I would need approval from the full board.
I move approval of the insurance packages presented today.
I'll second the approval. Okay, we got a first and a second, all in favor?
Aye.
Opposed? Same sign, motion carries. We'll go to,
I do have a few more things that just give you an update on. So the Dr. Garden mentioned to you all that he has signed an agreement. We'll be starting February 24th as our general surgeon moving forward, and you approved the purchase of the Da Vinci robot, and that will be delivered here end of December. So just to give you a quick update on that, right now we're using Dr. Dinesh Kaur, and I think Karen mentioned that, as our interim general surgeon. He took Dr. Custer's place here about a couple weeks ago. So that's a little update on general surgery. Rheumatology, we are going to have a rheumatologist that will start here in January, Dr. Gondraber, and that's going to be just a half day per month, and it'll be telemedicine. So we haven't had rheumatology coverage for quite some time, so it's good to get that back on the slate of specialists that we have here at Myrtue. I don't think, you didn't say the med staff, new med staff officers? Okay, so every 2 years we switch our med staff officers and our chief of staff, so the medical staff did vote on that, and Dr. Devine will be our chief of staff moving forward for the next couple of years. Dr. Bendorf will be our, he's the VP for the next 2 years, and Dr. Flores will come on as our secretary treasurer, which will be the first time that she's been on one of our med staff officers. And then just one other item, I was told that this week we will have our 100th delivery for the calendar year 2024. So it's been a little while since we've hit that number here. If you look at it over a fiscal year time frame, we are projecting to be about 120 for the fiscal year. So definitely seeing those deliveries pick up. But that's all that I have.
okay, for Dr. Garden, is that going to be next month's approval for the credentialing and receipt? When will that go through?
Probably in January. Probably in January.
Perfect. All right. Next, we'll go to for the consideration of approval of capital purchase for the sterile processing equipment by Nicole.
All right, so here to talk about our sterile processing department. So overview of the department, our sterile processing department obviously decontaminates, cleans, and sterilizes all of our instrumentation facility-wide. So each department sends all of their instruments down to that area, and we process those and then we distribute them. So a few years ago, Kelly Lynch had come to the board with a strategic plan for the next few years, and at that point in time, we purchased 2 new sterilizers for the department. So today, I'm just coming to kind of continue on in that strategic plan with a couple of new items. So, all right, so we'll just go through kind of what we have right now in our sterile processing department. So, as discussed, we have a large sterilizer and a small sterilizer. Those were purchased in and around 2022. We have a small ultrasonic shaker that's a tabletop that has been here for a number of years, and my best guess was 20 plus years at this point. Our Gedinga washing machine was purchased in 2017, and that's what's used right now to wash all of our instrumentation. And then compressed air was added in 2021. So as discussed, our washer disinfector is currently what we use to wash all of our instruments and accessories. So when you look at this, just think of a really large washing machine. That's essentially how it functions. And then we have a large sterilizer, and as you can see up there, it's 270, 275 degrees. And so we use this daily. Most of our pans and instruments go in there at the end of the day and or throughout the day, and we disinfect those with the washer and then sterilize them with the sterilizer here. So if you see like the big blue wrapped items, they go into this machine and then they come out, and then we can utilize them again. The small sterilizer, we have this, again, it's the same temperature as far as like high temp versus low temp. We use this a lot for special cycles, so our batteries that we use for orthopedic cases and things like that go into this one typically. Our peel pack items, so those items that you might see that we just peel open one instrument, we use this a lot for that. And then we also use it if we need to turn over an item same day. So just for example, on a day where we do a lot of carpal or cubital tunnel surgeries, we might have to reprocess the instrumentation used earlier in the day to use for a later case, and that's essentially what we use that small sterilizer for. It's a quicker turnover time than throwing them in the large sterilizer. And then if you can see that's our 20-plus-year-old sonic shaker that we use right now. So we use that for our smaller instrumentation. We use that for our cataract instruments and some of our like carpal tunnel instruments as well. So what we're looking to upgrade, and Kelly had brought this again, like I said, a few years ago, is to upgrade to an ultrasonic washer. So this would be utilized with our current washer. It's just an added component. And so the ultrasonic washer works in a way of it sends ultrasonic sound waves through the water, and it allows it to really get into those finer, smaller, intricate utensils to get out the debris that might be in there. Also looking at a low temp sterilizer, so as you can see, this is more of the 122 degree Fahrenheit range versus the 270 to 275. And this would be used for a lot of our electronic accessories, so our cameras and our batteries. It really will help prolong their life because that low temp is easier on them than throwing them in the high temp sterilizer. And then we do have a compressed air on. There's a clean side and a dirty side in the sterile processing department. Right now we have one on the dirty side of the department, and it would be nice to have one on the clean side. So those smaller, finer instruments, you can blow air through that to help get the moisture out. And we would do that prior to then putting them in the drying cabinet, which is the next piece of equipment that we would like to have. So this can be utilized for instruments that are washed by hand. It is utilized for any of the robotics instrumentation that we will have in the near future, and it can just help accelerate the dry time. So in doing that, it would decrease maybe the amount of instrumentation we would need if we had this, because you can turn it over a lot faster and be able to utilize it again rather than just letting it air dry. Any questions on any of those pieces of equipment?
Does this drying cabinet, does this have heat then, or just, you said it's not just air dry, it's got some kind of heat to it?
It's just a drying cabinet, so yes, it just pushes air through it even more to help get that moisture out.
Okay.
Yes.
So for most of the processes on the sterilization, it's basically heat that's doing the sterilizing, except for like the ultrasonic and the washing.
Yeah, so we could talk through real quick, like when you bring instrumentation into the room, you're gonna bring it into the dirty side. At that point, we have a decontamination sink and it goes into each, there's 3 compartments. So honestly, if you want to think about it like a dirty dish pan that you use, like a casserole dish, you put it in the first area of the sink to get the big pieces off, you move it to the next one and the next one, so it progressively gets cleaner. As you do that, then you put it through the washer at that point. So whether it's the ultrasonic or the getting the washer that we have, you can choose which one. And then at that point, when it comes out of the washer, it comes out on the clean side. And then you have to allow time to dry, which again, it would help with the drying cabinet. Then you wrap it in glue or put it in a peel pack and put it in the sterilizer at that point. Once it comes out of the sterilizer, it dries for a little while because it'll puff up and then it'll kind of sink back in as it's wrapped, and then it's ready for use again. So yes, the sterilizer is what will allow it to be ready for use again. Okay, so from a finance perspective, these are the numbers we would be looking at. So the ultrasonic washer is around the $93,000. The low temp sterilizer is the highest dollar item at $176,000. The drying cabinet is $17,500, and compressed air around $5,000, for a total of a little over $290,000 for all items. So the recommendation would be that we move forward with these and upgrade the sterile processing department to just continue on in our strategic plan.
Our current equipment doesn't per se have any trade value or any salvage value to it. Are we just going to keep what we have and add this in addition to then?
Yes, because we would still need what we have, and this would just help us continue to provide best practice and follow guidelines in order to reprocess our instrumentation.
Be more efficient.
Yeah.
Mostly to reduce turnover time for some of that, if you having only so many sets of instruments or whatever.
Yeah, I think it can prolong the life of the instrumentation that we have. As far as the low temp sterilization, that will help with that. And then the drying cabinet is the big one to try to increase or decrease the
drying time to make it more available, or?
Yes, exactly. Yep.
I'll move the approval of the capital purchase for the sterile processing equipment.
I'll second that motion.
We have a first and a second. All in favor?
Aye.
Opposed? Same sign. Motion carries. Nicole, do you have anything else?
I don't.
Good, okay. We'll move on to consideration, the approval of monthly financial statements. Christie will handle that.
So in front of you here is the condensed financial report for the 4 months ended October 31st of 24 and 23. So if we just look at the 1 month of October, we had about 489 outpatient visits to our facility, 484 emergency room visits. Surgical procedures were 128, over 4,085 visits to our physician's clinic area, and our behavioral health visits were 1,263. We did have a little bit of an increase in our average daily census of 7.38 patients per day in our facility. That does include OB and West. We had 4 births this month in October. So we're at almost 5.4 million in operating revenue, 5 million in operating expenses, and about $44,806 in non-operating net losses. It's mostly just fluctuations in markets for our investments, kind of. So net income from all sources in October of this year was $304,000. Last year we were at $253,349. Year-to-date, you can see we had a 5.9% increase in the number of visits in our outpatient area to almost 21,000 there. Our emergency room visits have gone up 3.4% to 1,963. Our surgical procedures are up to 494, which is a 5.6% increase. The physician's clinic visits are up over 15,249, which is about a 7.9% increase. Behavioral health visits have gone up 2% to 4,633. In our total inpatient, our total average daily census is at 7.3 compared to 7.9 last year, which is about a 3% increase. We are still seeing a decrease in our acute patients. Swing bed, we had quite an increase this year from last year. In observation, again, a little bit of an increase, 7.8%. Our births, we're up to 38 births this year in this 4-month period, which is 52% higher than we were for the year-to-date 4-month period last year. So we're at about 20.3 million, 20.4 million in revenues, 19.2 million in expenses. Our non-operating net income is at 833,000 for a 2 million, just a little under a 2 million net income from all sources for this fiscal year. Last year we were at 387, 388, which is a significant increase. A lot of that is related to the new Medicaid directed payment program that Iowa is now involved in. So it's a significant program that we hope to keep going forward with. Any questions on the short month to 4-month financials? On the 4-year comparison, you can see our outpatient visits have just continued to grow over the last 4 years. Emergency room visits have fluctuated slightly, not significant in any 1 year there. Surgical procedures, we're still seeing a little bit of an increase there. Still seeing in that 430 to 500 range there. Physicians clinic visits, pretty consistent there, down a little bit in 22 and 23, but we're consistent, just a little bit slightly lower than we were in 2021. Behavioral health visits, again, saw a spike there in 2022, but pretty consistently around that 4,600 visits for the first 4 months of each of the 4 fiscal years. You can see there our average daily census back in 2021 was 9.84. We're down to 7.3, so a little bit lower number at 7.09 in 2023. You can see our births there have fluctuated about 10 every year from 28 to 37 to 25 to 38. Operating revenues continue to grow, so has operating expenses. Net income has continued to grow over the years, and as you can again see there, for the first 4 months of this fiscal year is considerably higher than the prior 3 years, and again, that is due to our expenses are not going up as fast as our revenues have been, but also that Medicaid program. The full financial reports are in your packet. Continuing to watch accounts receivable as always, but we've gotten through the breach and the change, so things are processing more efficiently now. But nothing really to note there on the financial reports. Any questions?
All right, if no questions, can I get approval of monthly financial statements for October 31st?
I'll second.
Okay, we got a first and a second. All in favor?
Aye.
Opposed? Same sign. Motion carries. We'll go to the approval of payroll and claims for October. Were there any questions on the payroll and claims that we were handing out earlier?
Move approval of the payroll claims.
First, can I get a second?
I'll second that.
First and a second, all in favor, say aye.
Aye.
Opposed? Same sign. Motion carries. Any other questions or anything to go over, Barry?
I think Jeff is going to do a quick update on the inspection.
Sure. Things are moving pretty quick. We're going to see a lot of changes over the next month. And steel will be arriving here next week or the following early, and it starts being erected first week of January. They're currently pumping concrete as we speak right now on the entryway on the south entrance where the providers enter and employee entrance. Thursday they're going to pour at least half of the slab or the floor that is laid out. The other half, they have a little bit of dirt work left to do. Put the rock in, tap it down, and then it'll be pretty much ready to be poured. So lots of visible changes will be coming up over the next 3 to 4 months. So it's exciting to see this. As you drive by off of 12th Street, you see how high the retaining walls are, the foundation is. It's about 9 feet tall in that far southeast corner. So a lot of work. I see probably 15 guys working right now on that area. So
Has the cold weather been a hindrance at all?
not really. Just more so on the workers feeling it. Pouring the concrete, we don't have much of a concern about the concrete freezing because as it cures, it creates and generates a lot of heat. They've also taken the precautions to run ground heaters, so they're just big geothermal type heaters that they heat glycol solution, pump it through a bunch of hoses on top of the ground to keep it warm. They also have been covering it, so taking the appropriate precautions to ensure there won't be any adverse effects on the water freezing within the concrete.
Has the ER been, it's been open close to a month now, has that been going as planned?
I think everybody loves working in it, a lot of space, I haven't heard anything, but
Their biggest complaint was the toilet paper roll only gives you one sheet at a time. They're like, if that's your biggest complaint,
We'll make note of it.
we're good.
Get that changed.
yeah, there's a couple punch list items that are still being worked on, but for the most part, it's operating very well. Having to, remember, where did I put these, put them in each of the rooms, and, so everybody's learning, they're doing a great job. It's been, I think, really nice with all the extra space, because I have seen 7 and 8 rooms full, where before, those last 3 patients would have been in the hallway or in the So it is nice to get that. The behavioral health rooms have been very beneficial. Procedures, the traumas, a lot of space, the ability to work without bumping into everybody is enjoying it. We had a little bit, I don't know if you remember the open house, there was a vent that was pretty loud. We think we got that fixed yesterday, knock on wood, but just a few things that we just have to work through.
I've heard a lot of compliments, so I would
Good.
compliment all of you that were responsible, pretty much everybody in the room. Yep. It's awesome.
Yeah, some very impressive work being done by everyone,
Yeah.
all departments, and it's really good to see.
I also want to comment on the public health department that worked on the gas leak. Our office was one of the places that was closed. It was no big deal for us, but it was a big deal for a lot of people who left their homes. And I'd gone down to Vets Auditorium, and the folks that were from the hospital were just terrific. I mean, everybody was very calm, they got good information, and that was really handled very well.
Yeah, I think as part of that, Karen was involved, but they set up their war room or the command center here in our boardroom, and we have a new touchscreen monitor that's in there that I heard great things about. Everything worked well. I think there were, about 15 people or so coordinating efforts, and so we were able to accommodate every need that they had. I think it did go very well.
Perfect. Anything else to add? Any comments? I guess we'll call for an adjournment. I get a motion. a second. All in favor, say aye.
Aye.
Opposed? I don't think there'll be any. Motion carries. Thank you.
Brenda Collins.